Okay, hello and welcome from the National Brain Tumor Society. During this installment of the Public Policy and Advocacy Educational Web Training Series, we will discuss how government funded medical research benefits the brain tumor community, how the budget process works in Congress, and how advocates can intervene in the process to advocate for the brain tumor community. I have just a couple of housekeeping items to go through before we begin. To minimize background noise, we will have all webinar participants muted. However, we do want this to be an interactive training, so please ask any questions you may have by utilizing the chat feature on your Zoom screen. Lainey will send a chat now, which will pop up on your screen and show you where to look for the chat feature. Feel free to ask questions throughout the training, and we'll do our best to answer all questions following the main presentation during our Q&A session. If your question is not answered during the webinar, please email us at advocacy@braintumor.org. We'll also be recording this training, so it will be accessible online within a handful of days. So we'll email that link to all of our advocates for their reference. My name is Casey Troy, and I'm the Research and Advocacy Manager here at the National Brain Tumor Society. Joining me on this web training today are my public policy and advocacy colleagues, Lisa Peabody, our public policy associate, and Lainey Titus Samant, our director of advocacy. We're also delighted to be joined by our special guest, John Lee, who is the director of the Policy Resolution Group at Bracewell LLP. The National Brain Tumor Society works with Bracewell to advance our policy issues on Capitol Hill. So let's jump in. First, I'd like to direct you to the policy and advocacy section of our website. We provide a deeper dive into public policy and advocacy and general guidelines for building relationships with your members of Congress in a couple of previous web trainings. When you visit braintumor.org and click on Your Voice, you will be led to our advocacy pages on our website, and under the Tools and Training tab, you'll find our previous web trainings. A comprehensive guide for in-district meetings will be found on this page as well. And these trainings are useful to all advocates, whether you've been an advocate for years or are just considering, joining the community to advocate for the brain tumor community. So definitely check out those links and webinars when you have some free time. A common question that we hear is, what really is brain tumor public policy advocacy? And brain tumor public policy advocacy includes a variety of activities which have the ultimate goal of making a change to policies that affect the brain tumor community. One example is just calling your senator to ask that they vote for a bill investing in medical research funding, which we'll talk about more during this webinar. Each time you make a phone call or send an email to your members of Congress to ask them to support a certain piece of legislation, you're participating in public policy advocacy. The National Brain Tumor Society is always keeping an eye out for upcoming bills and legislation that might affect the brain tumor community, and we determine our legislative agenda based on the needs of our community. We also work with other coalitions and alliances in our public policy activities. Brain tumor advocates build working relationships with Congress and are a source of information on our policy agenda. You bring your own experience and speak for the brain tumor community on a personal level. The ultimate goal is to persuade Congress to support our policy agenda, which supports the brain tumor community. And you do that by educating your members of Congress on your brain tumor experience as someone who lives in their district or state. You make a personal and local connection with that member of Congress, and you build working relationships with those members and their staffers. So when you have an ask, they are likely to listen and respond to what you're asking for. And we go into great detail in those webinars I mentioned just a minute ago on how to create those relationships and build and maintain them, so you are able to make that ask and persuade Congress to support our public policy agenda. So I would like to, now that you have a baseline of our public policy advocacy program and what it means to be an advocate, I'd like to welcome Lainey Titus-Samant, our Director of Advocacy, who will be talking about medical research funding through the National Institutes of Health.
Thanks, Casey, and thanks so much to everyone for joining us today. We had hoped to start doing our webinars this year after all those webinars Casey talked about last year that focused more on how to be an advocate, talking about some of these specifics on what we're advocating for. So government-funded medical research. We've gotten some questions over the years about why the government should be funding medical research and why it's so important and how that affects the brain tumor community and brain tumor research. So it's seen as a public good for the government to fund medical research, something that benefits all Americans. In addition, for brain tumors specifically, it's easier to focus on more common diseases when looking at research, and rare diseases such as brain tumors may get left behind. So government funding of medical research allows attention to be focused on rare diseases where the number of patients may be smaller. In addition, the government funds basic science, which may not lead directly to drug development, but it will direct public health decisions or maybe lead to further research and discoveries. So for example, basic science research may look into something like how a cancer cell grows. So that may not necessarily lead to the next treatment for a brain tumor or another specific type of cancer, but that can lead to increased knowledge that may further inform other discoveries that could lead to treatments down the road. Additionally, the government funding for medical research, some of that goes to the Food and Drug Administration, and the FDA's role is to ensure the safety and efficacy of treatments offered to patients. So that is definitely an important role that couldn't be filled by private philanthropy. And all of these things, government funding of medical research, make sure that things are more equitable, that things like brain tumors are being studied, this basic sciences research is happening. So private philanthropy wouldn't be able to cover all of those things. So we're grateful in the brain tumor community that the government does fund medical research. So when we're talking about medical research funding, for the most part, we're talking about the National Institutes of Health, and that includes the National Cancer Institute. So here's some information on NIH, because some people wonder how exactly does that work. So more than 80%, and this is something that I found interesting, more than 80% of the NIH's funding is awarded through almost 50,000 competitive grants to more than 300,000 researchers. Lots of numbers here, at more than 2,500 universities, medical schools, and other research institutions in every state and around the world. So I know this map is probably pretty small for you, but you can find this on the NIH's website, and it shows you that there is funding from the NIH going to every state in the country. So wherever you live, there is NIH funding going to your state to fund some type of research, which is really cool. The darker states on this map receive a little bit more of the funding, and a little less goes to the lighter color states, but it is going to every state in the country. And then about 10% of the NIH's budget supports projects conducted by nearly 6,000 scientists in its own laboratories, most of which are on the NIH campus in Bethesda, Maryland, so just outside of Washington, D.C. So some of you, hopefully many of you, heard the news last week that a new budget was passed, and John Lee will be speaking further about exactly how that all works and how this came to be. But the good news out of that is that for fiscal year 2018, which is the fiscal year we're currently in, NIH received $37.084 billion in medical research funding. That is a $3 billion increase, almost 9% over fiscal year 2017. That's also the largest increase to NIH funding in the past 15 years. So this is really fantastic news. It's a major victory for all of you, our advocates who have spoken to your members of Congress asking for increases in medical research funding. And it shows that Congress is continuing their commitment to increasing funding and knows the importance and value of that. So the National Cancer Institute also received $5.9 billion in this latest budget. And that's an increase of $275 million over last year. It also includes $300 million in funding for the 21st Century Cures Act. That was a bill that passed at the end of 2016. Some of our longer time and engaged advocates will be familiar with that bill. The goal of that bill was to bring new innovations and advances to patients, invest in infrastructure, and promote collaboration and sharing between doctors and researchers. So we're pleased to see that that is continuing to be funded in this current budget as well. So how does this all affect brain tumor research, and why is this important for brain tumor research? So the National Institutes of Health, including the NCI, are the largest funders of brain tumor research in the country. And we probably don't need to tell all of you on this call, but brain tumors have among the fewest therapeutic options, and therefore research funding is absolutely critical to finding new effective treatments for brain tumors. And so when we talk about the NIH, it's not only the NIH and NCI, but there are a few different ways how brain tumor research and clinical trials are taking place through the NIH and NCI for brain tumors. So there's an institute called the National Institute of Neurological Disorders and Stroke, and that supports neuroscience research and disseminates scientific discoveries to stakeholders. There's also the NCI's Clinical Trials Cooperative Group, and that conducts state-of-the-art research on potential new adult glioblastoma therapies. The NCI's Pediatric Preclinical Testing Platform, that's an essential component for testing the safety and efficacy of new drugs before evaluating them directly in children. And then the NCI's Neuro-Oncology branch, that will sound familiar to any of you who have attended Head to the Hill in the past, and hopefully some of the rest of you will attend this year. We usually hear from the director of that branch. It's a critical place for patients throughout the US to seek cutting-edge treatment advice from the clinicians and researchers there. So there's a lot going on for brain tumors within NIH. It's not only just the larger umbrella NIH, but within all of these separate institutes and programs within NIH. So that was a quick overview for how brain tumor research and other medical research happens at NIH. And I'd like to introduce now Lisa Peabody. She's our Public Policy Associate who meets directly with members of Congress and their staff on Capitol Hill to discuss the needs of the brain tumor community. And Lisa's going to talk about another way brain tumor research is funded through the government via the Department of Defense. So thank you, Lisa.
Thanks, Lainey. She did a great job of explaining all of the ways that NIH is connected to us and to the brain tumor community. So, you know, oddly as it is, there's a second pocket, or I call it a bucket of money. We have one bucket of money in NIH, but then we have another bucket of money for brain tumor patients within the Department of Defense. So the Department of Defense has created a medical research funding program, because our servicemen and our military personnel, they're sometimes exposed to warfare and environmental factors that we don't know much about. And so we want to keep them safe while they're deployed and safe when they're in vulnerable environments, and do research to make sure that we're keeping them healthy. And through that program, through that study of military servicemen, Congress also created another program under that umbrella called the Peer-Reviewed Cancer Research Program. And so that's actually a cancer granting program, just like Lainey mentioned how there were 50,000 grants delivered through NIH. The PRCRP, this Peer-Reviewed Cancer Research Program, also has grant funding available. And the idea behind this program was that the servicemen also contract cancer, and when they do contract cancer, it interferes with their ability to complete their mission. Sometimes they have to come back from being deployed. So this was also an important research area for servicemen and women to complete their work with the military. What's great about this funding is that the Department of Defense was pretty smart and understood that researchers are great across the whole country. And so rather than limiting applications to only military personnel, they've allowed anyone, any researcher, to apply for these grants. We have a really impressive pool of applicants that apply for this money. The other piece that Congress decided is that rather than have this program open to any cancer, they narrowed it, they slimmed the qualifications for this program to include cancers that are less likely to be studied, rare diseases, diseases that are lagging behind in treatment options. And so for the brain tumor community, this is the perfect place to house grant opportunities for researchers. And NBTS and advocates here on the phone have been amazing at making sure that Congress every year includes a topic of research that has brain cancer or brain tumors in it. And so your work at Head to the Hill and your response to action alerts has made Congress aware of how important it is to include brain tumors as one of the optional categories. And so the categories have ranged between 11 different topics up to 14. So it's a pretty narrow group. And we're really proud of the work that you've done. So we've kept a brain tumor category within that program. So how have we had success through the PRCRP? It's pretty amazing. So in 2016, there were $4 million worth of awards for pediatric brain tumor research, a really outstanding amount given to our researchers. And so you might be wondering why in 2016 there was only awards for pediatric brain tumor research. And that's because in 2016, we only had one category. But again, because of the work of advocates and because of your continued relationships with Congress, last year, 2017, we led a program to add a second category of brain cancer. So now we have pediatric brain tumor research as an eligible research project, and also brain cancer. Really opens the scope for researchers across the country to apply for this money. And we have, a really great development that happened in 2018. So not only in 2018 did we get our two categories, pediatric brain tumors and brain cancer, we were also granted and advocated for an additional $20 million to the budget of the PRCRP. So we'll be looking in the spring to see who was funded in 2017, and then we'll get a sense of how many dollars went to both pediatric brain tumor research and adult brain cancer. And we hope that number grows greater than $4 million. In order to make sure that we have a robust group of participants, of researchers in brain tumors and brain cancer, NBTS has an outreach program where we actually share information and reach out to researchers across the country to make sure that they know that this funding exists and that these grants are pretty big numbers for them. So, now that we kind of understand the two buckets of money where we've got this NIH money and this Department of Defense money, government has sort of a whole process and a system, a step-by-step, where they begin to develop how their budget is going to be appropriated or portioned out to these different programs. And so we work closely with John Lee, who's the director at the Policy Resolution Group with Bracewell, and he helps us with that process, and he helps strategize and guide us so that we're sure we can move our legislative agenda forward. So John's going to talk a little bit about the process and his strategy.
Thank you, Lisa. Hi, everybody. My name's John Lee, and as Lisa said, I'm here at the Policy Resolution Group at Bracewell. And before we dive into budget and appropriations 101, I wanted to give a quick word just about who we are. We're based here in Washington, and this is now our 5th year working on public policy activities with the National Brain Tumor Society. Bracewell itself is a large law firm with both national and international offices, but here in DC, we also house our government relations and communications practice, which is how we began our work with NBTS. There's about 20 of us in the group who have experience on Capitol Hill working for members of Congress or have worked for various federal agencies in the past. And I would say that we cover a wide array of different industries, but in healthcare specifically, some of our experience has been with trying to get a domestic supply of medical isotopes here in the United States that are important in diagnostic procedures. And we also help device manufacturers with the process at FDA. Sort of on an exciting note too, we recently met with the board for the Society for Neuro-Oncology, and we're hoping to get them involved on the brain tumor advocacy front as well. So in terms of the congressional appropriations process, I think the most important note to take away, and this is something that gets pretty confusing because the press frequently will confuse these aspects and not be clear about it. But budget and appropriations are different aspects, and they're different parts of the process. And as you may have read in the press last week, Congress finally finished a spending deal for fiscal year 2018. And a lot of people in the media would refer to that as a budget, right? And it is a budget in the sense that it tells Congress and all the federal agencies how the money should be spent. But what that really marked was the end of the appropriations process and the money physically being doled out to those federal agencies. So first and foremost, as opposed to a January to December schedule, when we look at congressional funding and how it's relevant to the brain tumor community, we need to understand that it runs on a fiscal year schedule. So this is October 1st through September 30th. And you might be thinking to yourself, okay, well, that would mean that last September 30th, so September 30th, 2017, that's when we would have needed to get the fiscal year 18 appropriations done. And you're exactly right. So usually by September, Congress should have finished planning how they're going to spend their money for the next year. And what we saw instead was it took until last week. So we're in mid-March. So in between the end of September and March, the way the government was able to remain open was through these resolutions called continuing resolutions, or CRs. And frequently you might see on cable news or online that there's these risks of government shutdowns. And what that means is that Congress has gotten to the point where they need to pass a budget. There's a deadline, right? But they don't have the deal done. So instead they need to pass these continuing resolutions to keep the government open. And we saw that happen until March of this year, which is a pretty long time because now fiscal year 18 money is just starting to be doled out, and they will only have a few months to use that money before fiscal year 19 will actually begin. So in terms of, we talked about sort of what happened last week in terms of what was actually passed, and that was a gigantic spending bill. It was $1.3 trillion. But probably the most helpful way to look at that is the deal itself comprises of 12 different individual bills, and those bills are tied to subcommittees that are in charge of a few departments each. So you'll see below that of which subcommittees are particularly relevant to us. And within the Labor, Health, and Human Services subcommittee, that's where NIH gets all their money. So we do a lot of advocacy with the subcommittee members on labor HHS. But in terms of the peer review cancer research program, which Lisa just spoke about within the Department of Defense, Defense has its own subcommittee out of the 12 individual subcommittees. So those are really the 2 out of the 12 subcommittees where NBTS is actively participating in the appropriations process and trying to make sure that we're getting as many resources as possible. So what ends up happening is if things worked the way they were supposed to, those 12 subcommittees would pass out bills out of committee. And we'll get to that in a little bit. But when that doesn't happen, we get to the point where we were at last week, where everything has to be combined in one bill because they weren't passed previously. So if you hear the term omnibus, I would say probably that continuing resolutions and omnibus are the 2 wonky terms here. Omnibus, all that means is that they're just combining all of the different types of appropriation subcommittee bills into one bill for the president to sign. And usually if they're putting together an omnibus, it means they didn't do a good job the whole last year of trying to get out the bills the way they're supposed to go. And now at the last second, they have to rush to push everything together. So that's sort of a recap of what's happened in the past week or so in terms of getting a spending deal done. But I think sometimes it's helpful to think about how things are supposed to happen, right? And if the process went the way it's supposed to, what that would look like in a typical year. And that's really what informs us and the advocates on when we should be reaching out to members of Congress and when we can hopefully start seeing results. So typically, the start of the appropriations process always begins in February, and that's when the president's budget will be released. And a lot of people put a lot of weight into this, the press especially, because I mean, it's a big deal. The president is making his priority statements, and you want to make sure that NIH and PRCRP are valued and prioritized in the president's budget. But in reality, and if you ask any member of Congress, they will remind you of this pretty much on a daily basis, that the Constitution gives them the power of the purse, not the president. And what that means is that at the end of the day, it's really Congress who gets to make these decisions. And although we would love for the president's budget to be in line with our own priorities, you saw it last year with our NIH funding, whereas the president released his budget and in it was a start to decline for NIH. We instead saw an increase because it was up to Congress to make that final decision. So when the president's budget gets released in February, what Congress is actually looking at in that document is how much the president envisions each of those 12 subcommittees that I mentioned earlier, what should be their top line level of spending. So what that means is that each of these 12 subcommittees, including defense, including labor, health, and human services, will get a top line number of spending, and then it will be up to the committee to write a bill to figure out how to spend that money. But in terms of I mentioned earlier the difference between budget and appropriations. Budget really only refers to this part of the process, the president releasing his budget request to Congress, which is really just a request, and then the Senate and House taking the top line numbers from that budget request and agreeing on them through a budget resolution to then inform them how they should be spending the money moving forward. So after February, that's when the subcommittees can get to work. And this happens March through May, typically. Again, this is how it's supposed to happen. But now that they know how much money that they'll be able to spend, the committee staff starts taking requests from members of the committees of what they want to see the money go towards. And as you can imagine, each member of Congress has some pretty strong ideas about where the money should go. Specifically, projects in their district are oftentimes priorities so that they can go back and report that they've been able to successfully advocate for priorities in their district. So once all those priorities are collected, the bills are then reported out of committee. So committee will hold a hearing on the bill and then they'll all vote on it, right? And then it gets to the point after it makes it through committee where it makes it to the entire chamber floor. So this usually starts in the House. So what will happen is the House Defense Subcommittee will pass their bill. It would then reach the entire House floor, which would vote on the bill and hopefully pass it. And then the Senate would do the same thing and pass their version of the bill. And at the end of the day, those two bills would have to be reconciled so that they matched. And each of those 12 bills would then have to be finished and signed by the president before September 30th. This is what regular order is, right? Each of these 12 bills, this process would have to wrap up by September 30th by the end of the fiscal years. And the president would actually be signing each of these 12 individual bills. And I don't think it would surprise you that this process hasn't happened the way that it's supposed to for now many years. But it is a goal of Congress this year, especially in an election year, to try to get it done the way it's supposed to happen as laid out by congressional rules. So hopefully now you have a sense of what happened with last year's spending deal, right? And why it took longer, and now we've also gone through sort of the step-by-step process of what you would expect to happen in a typical process. But what I want to focus on now, and perhaps this is the most relevant part of the presentation in the sense that it informs us on what we need to be doing in the next few months to make sure that our priorities are heard for fiscal year 19. So the president did release a budget in February for fiscal year 19 that predictably incorporated large cuts to the NIH. But as I mentioned earlier, we can take sort of a deep breath after we review that document, because it is just a guiding document. It is it's simply giving them those top line numbers, and doesn't, Congress at the end of the day will get to decide where the money goes specifically. So part of the reason that fiscal year 18 took so long was because the House and Senate could never agree on what those top line numbers should be after reviewing the president's budget. But once they came to an agreement on that, they also locked in those same numbers for fiscal year 19. So what that means is that Congress is right on track to work through the appropriations process through typical rules and regular order, due to the fact that they have now agreed ahead of time how much money each subcommittee should be spending. So the appropriations process is underway. It was happening sort of as this fiscal year 18 year was finishing up. And Lisa and I, with your help, have been sort of all around Capitol Hill to make sure that NIH and the peer review cancer research program is receiving the attention it deserves for fiscal year 19 as well. So as we sort of get to the end of this, and as Casey and Lainey mentioned too, we're happy to take questions. It hopefully will be helpful to look at this in terms of a specific example to get a clearer picture of how this step-by-step process works. And I know I've given you a lot of information, and Lisa and I always laugh that it's taken us years now to actually figure out when this all happens step by step, so that it's okay. But I think this should hopefully be sort of a way to see how the process lives and breathes. So for PRCRP, which Lisa walked us through a couple minutes ago, in fiscal year 18, so this is last spring, we started meeting with members of that House Defense Subcommittee to ask for a strong commitment to PRCRP. So what this means is, after the president's budget came out, Lisa and I started visiting with these members of Congress who serve on that committee in particular to make the case for why PRCRP funding needs to be increased. And what we did for each of these offices, fill out, they all have various forms that they ask organizations to fill out to keep track of their requests. And we fill out these forms, and we rely on your help to fill them out, in the sense that for each district, we want to let them know how strong is the advocate community there, what types of events are being held in the states. And our goal is to make a connection with that office so that they feel like they have a tie to the issue within their district, and that they're really helping constituents by pushing for our ask. So in addition to filling out all these forms, simultaneously, we asked ourselves, how can we get other people to weigh in on this, to make sure that it's not just our voice, but it's people who are our allies to weigh in as well. And part of that effort involved the Alliance for Childhood Cancer. Around 30 organizations signed a letter asking Congress to increase the budget for the peer review cancer research program. We also organized congressional letters, both on the House and Senate side. 33 members of Congress and 8 senators signed letters, and it's important to note that these are members not on the committee. So the way that they are able to add input to this process is by submitting letters to committee staff, so that their voices can be heard during the process as well. So we submitted all these letters, we met with all the offices, we submit the forms, and in the meantime, we rely on all of you to continually reach out to these members, specifically the members on the appropriations committees, to let them know why these efforts are so important, and to hopefully put pressure on them to include this as a top priority for them when they submit their list of requests. So as Lisa mentioned before, we were very excited that fiscal year 18 resulted in an increase from $60 million for the program to 80 million. And that could not have happened without the efforts of our advocacy community, stepping up, reaching out to these subcommittee members. And 80 million is the strongest the program's ever been. And as Lisa has mentioned previously, we have a few eligible categories: brain cancer, pediatric brain tumors, that are now open to us to apply for. And we're hoping that the portion of that budget that we receive every year will continue to grow. We know that out of the fiscal year 16, 50 million pot, we received about 4 million of that. So we're assuming and we're hoping that with that $80 million, now that we've increased that number by about 30 million in the past 2 years, and now that we've increased the number of eligible categories, that we'll be able to get a larger share of that funding. So you'll see that as a whole with the PRCRP, we operate as if Congress is going to finish their work when they're supposed to. We try to get this all done in March and April so that when they're actually drafting these subcommittee bills, they hear our voices then. But then you just can't predict when they're actually going to pass it. It could be by the end of September, or it could be last week. So that's sort of a larger overview. I understand this was a lot of information and a sort of budget and appropriations 101. So happy to clarify anything, and hoping now that when you're focusing on your advocacy efforts in the future, this gives you a sense of sort of what Congress is doing and why sometimes it takes a little bit longer to get those answers of how much funding we'll actually see for these programs.
John, thanks so much. This is Casey again. That was really great information about how the budget and appropriations process works, and how NBTS and your team at Bracewell, as well as our advocates, intervene in that process, and how we advocate for the brain tumor community. I think that's a great background. And before we jump into questions, I just wanted to add to that the way that advocates often do intervene is through responding to our action alerts, which we send action alert emails to everyone who signed up to be an advocate to respond to an issue like medical research funding. And we provide a pre-filled letter that goes to the health section, the health legislative aid for your members of Congress, and you can personalize it to talk about, your personal experience with brain tumors and why medical research funding is important to you. And so that's a great way that our advocates stay involved, and we'll continue to do that throughout this process. So you'll always have the latest information and be able to take action throughout the process. So let's move on to questions. If you have any questions, feel free to chat them now. Lainey, do we have any questions that have come in throughout the webinar?
Nothing has come in yet, Casey. So if anyone has questions, feel free to chat them in the chat feature. Okay, let's see. So one question we had that just came in is, so when the president said he's not signing a bill put before him, do we have to worry? So I don't know if you want me just to take that, Casey, or if we want to give that back to John. I'm happy to give my input and have John jump in.
That sounds great. Yeah.
So yeah, if some of you were following the omnibus appropriations process closely in the past couple of weeks, there was a few moments when the president had indicated that he wasn't planning on signing the appropriations bill. And so do we have to worry if that happens? So I think, what would happen in that case if he had vetoed the bill that funded the government is it would have gone back to Congress, and then it would be up to Congress to do something with that. So they could either do nothing, and that would mean the veto would stand, or they could decide to vote to override the veto. And John can correct me if I'm wrong. If the numbers had kept consistent with how members of Congress had voted in support or against funding that omnibus bill, it would have had enough votes to have a veto override. So it still would have taken effect. But I think it all depends on the exact bill. But that option is always there for the Congress to go back and override that veto.
Hey, Lainey, I'd just add to that. So the Senate would have had the votes, but the House would not have. So if the votes stood the way they sort of fell when the original vote was taken, the deal would have fallen apart. And interestingly, the government was slated to shut down that evening at midnight, right? So if the president had vetoed, the government would have went into a shutdown, and then Congress would have had to scramble to produce a new draft for the president's desk in order to reopen the government. So I would say yes, it's always a concern that the president will need to sign it at the end of the day. So in a typical administration, you would want to keep those vehicles and lines of communication open the entire time so that you're getting real-time feedback from the administration. But given today's political climate, it's very up in the air, and just hours before he signed, it was unclear what was going to happen. So there's no way to tell, right? But eventually Congress would have had to get him a vehicle to sign, or the government would have remained closed.
And hopefully for 2019, things happen as they're supposed to, and we won't run against this deadline. So a government shutdown isn't a possibility, but we just won't know.
Agreed.
So another question that just came in was, if funding has been approved, what will we be advocating for at Head to the Hill? Which is a great question. And I think that goes back to the whole regular order versus the budget, the appropriations bills just being passed now. But normally this time of year is not when we see a new fiscal year budget and funding being approved. That normally happens at the end of, or sometime in September, to have the fiscal year, the new fiscal year budget approved by the time that it's starting on October 1st. So what we'll be working on now is advocating for funding for fiscal year 2019, which is set to begin October 1st. So this sort of allows us to resume that normal process of advocating in the spring and summer for medical research funding, and then having Congress pass those appropriations bills as they normally would, and have that all in place by the time that the new fiscal year begins on October 1st. So I think we're actually in a good place for that to happen this year, as John talked about. So we'll just be working on the fiscal year 2019 appropriations. And then, of course, other things, the other priorities that we have as well. Go ahead, John.
Yeah, the best part about the appropriations process is that it gets to happen year after year. So even though we saw these great successes with a $3 billion increase in NIH and a larger pocket of money for the PRCRP, our goal each and every year is to hit the ground running and make sure that Congress hears our voice, that these budgets do need even more resources. And we sort of saw that this year, even though the fiscal year 18 deal was not done, we were on the Hill talking about fiscal year 19, making sure that our requests were in when you would typically submit them, so that regardless of what happened with fiscal year 18, we were putting our best foot forward. So for Head to the Hill, it will always be an ask of ours to keep going with these commitments, because when we stop speaking up, that's when Congress thinks they can take some money and move it elsewhere.
Great point, John.
Great point. So we have a couple more questions, and John, this one is somewhat of a culture and climate on Capitol Hill, perhaps. But so there's an appropriations committee and a budget committee. This person is asking, and are they adversaries, or do they perhaps advocate for each other? I guess how do they work between each other?
That's a great question. So the budget committee is much less. Well, the appropriators would tell you that the budget committee is much less relevant and powerful than people think it is. And I would generally agree with that. The budget committee, their only job is to take the president's budget request and then create those top line numbers for each subcommittee. So that's a big deal, right? So each subcommittee wants as many resources as they can have, and that gets worked out. That needs to get worked out prior to the appropriators being able to start their work of divvying out the money or writing any bills. So the budget committee is an important part of the process, and I would say that they have to work hand in hand with the appropriators so that the appropriators are comfortable with what the budget committee will be passing. But I would say if you are tracking budget committee activities, what will be interesting in the next year is there's now a bipartisan task force to revise this entire process because it is such a mess. And that any type of change to the formal budget and appropriations process would have to be passed out of the budget committee. So I would say the budget committee is more of a place to watch for process, whereas the appropriations committee will help inform you where the money is actually going.
Great, thanks, John. And another question was, for FY 2019, are we also advocating for Congress to include a specific category of research at Head to the Hill? So that's a good question too, and something interesting to think about. I guess for the Department of Defense peer review cancer research program, yes, we're going to be asking that they continue to fund continue to make pediatric brain tumors and brain cancer eligible topics of funding. But as far as NIH and NCI, we won't be asking for specific categories of research within those. What we do is we have a good relationship with NCI. Our CEO, David Ahrens, has been heavily involved with interactions and meetings at NCI. So we do more of our advocating at that level to talk about the importance of brain tumor research through NIH and NCI. But as far as NIH funding at Head to the Hill, we'll just be talking about those larger numbers for funding. If anyone else has anything to add, please feel free. Okay, this is another kind of Capitol Hill 101 or Congress 101 question, which is great to get this background. Are members appointed to the Appropriations Committee, and if so, by whom? John, do you want me to answer, or do you want to jump in here?
You start first, and I'll jump in.
Okay, so a committee is appointed by leadership for the most part. So members, each member of Congress gets assigned to various committees, and a lot of that is depending on, sometimes I believe, John, you'll have to correct me if I'm wrong about this process, but I know at least in state government, you can make requests on which committees you're appointed to. I don't know if that's how it works in Congress, but it is leadership who determines which committees members of Congress will sit on.
Yep, that's exactly right. So through the steering committee, a part of leadership, they will make committee assignments as well as leadership assignments within those committees. And although you can request, it's a lot of it's based on seniority, right? So a freshman member of Congress will not be put on an appropriations committee because everybody wants to be on the appropriations committee because that's how you're deciding where the money is going. So they try to think about, given your district, if there's a lot of farming in your district, you might be on the ag committee. But for the sake of appropriations, it's generally more senior members who have been in Congress a while.
Yep, that's great. Yeah, definitely considered one of the best committees to be on, right?
Yes, absolutely.
Okay, so I guess the next question we have is just about how we can find out how specific representatives in the House or Senators voted on a bill, and so we can we'll work on getting that information out to our advocates. So thank you for that point in that question, Chris. We'll work on that. And then just a clarifying one for that last question, they were asking about, is it a one-year term? But it's so Congress goes in 2-year cycles. So right now we're in the 115th Congress, and that started last year, and we'll go through this year. Actually, we'll go through when the new Congress is sworn in January 2019. So I think that might be everything we have for questions. Again, as Casey said, definitely feel free to email us at advocacy@braintumor.org if you have any more questions, and we can get those answers to you. I'll chat that email address into the chat window right now.
Thanks, Lainey. So just before we go, hopefully this has given you some great background on the budget and appropriations process and how we as advocates can affect medical research for the brain tumor community. If you haven't already, please head to our website and sign up to become an advocate. That puts you on our mailing list. So when we send out action alerts or updates, you receive those emails. It's not a lot. We send a monthly public policy and advocacy update. And then, you know, just timely reminders and action alerts when we need some advocacy, grassroots advocacy action. So you go to Your Voice, the Your Voice section. Again, scroll down to become an advocate. And our signature advocacy event, we mentioned it a couple times, it's coming up. Registration closes on April 6th for Head to the Hill, which is our annual advocacy event on Capitol Hill, where National Brain Tumor Society provides a training and schedules meetings for our advocates to meet with their members of Congress on Capitol Hill. And it's a really exciting experience and empowering for you to actually meet with your members or their staff and let them know what your priorities are as a constituent, so that can inform their votes later on. So email us again at advocacy@braintumor.org or call me, Casey Troy, at 520-762-4544. I'd love to chat with you if you are, you know, wanting a little bit more information about what to expect or how to sign up. Thanks, everyone. And again, if you have any questions that weren't answered, email us at advocacy@braintumor.org, and we'll see you at our next educational webinar in a few months.